AIIMS Rishikesh is doing a wonderful job in management of diabetes, right from education to primary care to secondary care and to tertiary care. Our services include adult diabetes clinic, collaborative pediatric diabetes clinic, diabetes foot clinic, nurse education clinic for diabetes, and nurse-led diabetes follow-up clinic, and collaborative diabetes foot surgery and rehab. It also includes outreach program, not only for information, but also curative in terms of prevention activities. And we have got a multidisciplinary diabetes education academy. We are focusing on primary care by talking about patients and caregiver, one-to-one diabetes education for patients and family members in OPD as well as in indoor. And also the group diabetes education is there for family members. There are various health camps in the community and we focus on diabetes education for school health. For healthcare professionals, we are not only training the doctors, but also the nursing, dietitian, and everyone together. You will see that we are running an advanced diabetes certificate course for medical officers, diabetic educator course for nursing officers, diabetic education training program for dietitians, safe insulin administration program for nursing. We have seen a lot of patients here, almost close to 8,000 patients have been seen. One-to-one patient education was done in roughly 2,000 patients, and on these, out of these almost 1,000, we did a peripheral neuropathy analyzing, cardiac autonomic neuropathy analyzing, digital fundus examination, and FGMS. We have got a very advanced library, we have got a very advanced lab. In the lab, not only the peripheral neuropathy and cardiac autonomic neuropathy is analyzed, but also we do HbA1c, microalbumin in urine, and so many other tests including the ketones, and AGP reader and V caliper. So what we are running is a very advanced center with focus on education, prevention, treatment of complication, cure, and an overall 360-degree program. Thank you very much.
Yeah, I'm Dr. Ravikant, working as additional professor and head the Division of Diabetes and Metabolism, Department of Medicine, All India Institute of Medical Sciences, Rishikesh. This institute basically is an institute of national importance established by the Government of India, which is totally autonomous body to provide and to have innovative ideas to implement multimodality approach in various diseases. Since we are burdened with diabetes, so we are leading a very important diabetic division and metabolism in the Department of Medicine, which is catering approximately 5 days a week program in post-lunch period from 2 p.m. to 5 p.m. And the patients that we are dealing with, they are consisting of basically diabetes and diabetes complications. So far as our training is concerned, we are training both primary physicians as well as nursing officers, and we are bringing up a workforce that can take care of the diabetic patients in the periphery and in the community. We have a wheel and spoke model wherein we recruit patients both from community, where our community team is working very hardly, and we are currently running projects in diabetes both in schools, in the community, as well as in institution. We are also coming up with various facilities of ambulatory glucose profile, spot HbA1c testing, and on-spot urinary micral, fundal photography, as well as cardiac autonomic neuropathy. The specialized trained nurses that are diabetes educators, they take interviews with the diabetic patients one-to-one, teach them how to inject insulin, when to contact healthcare professionals the moment they feel there is any problem. So we are basically taking care of patients far and wide, and since this part of the country is catering a low and poor patients, this institute is really doing a wonderful job in taking care of these patients. Thank you.
Well, I'm introducing my institute. I'm working as a professor of nursing at All India Institute of Medical Sciences, Rishikesh. I'm today talking about our proposal about the Center of Education for Excellence in Diabetes Care. This institution has started with Parliamentary Act 1956, which was amended in 2012, and it came in existence and services were started for diabetes care in 2013. Today, we are offering outpatient department services and inpatient department services with wide range of patients coming to us for diabetes care. Be it just a consultation for type 1 or type 2 diabetes, or the surgical intervention for diabetic foot, or other complications because of diabetes, either it is eye or neural complications, renal complications, or so on to name. Today, we have large number of patients visiting our OPD and IPD for diabetes care services. We have OPDs as an adult diabetes, that is type 2 care, pediatric diabetic clinic. We have diabetic rehabilitation clinic, which is collaborated with PMR department, and collaboration with surgery department, we are offering diabetes foot clinic. We do have a diabetes nurse-led education clinic, and we have nurse-led diabetes follow-up clinic to ensure that the patients adhere to the treatment. We are providing these services for diabetes care and we do have research initiatives in diabetes. The two of the doctoral students doing PhD in diabetes care, one is doing her PhD on checking the efficacy of cinnamon for type 2 diabetes treatment, and other PhD student is looking forward the effect of nurse-led diabetes follow-up for adherence of the diabetes treatment and glycemic control. We also have taken other research initiatives in recent past. We have done a study to assess the barriers of insulin initiation in patients with diabetes type 2, hypoglycemia, and other diabetes related education initiatives and their effect on glycemic control among these patients. We also have taken initiatives regarding education in diabetes care. We run several programs. We teach modules of diabetes care to undergraduate medical students, undergraduate nursing students, postgraduate medical, postgraduate nursing students, and paramedical students. We also have taken a multidisciplinary small certificate programs in diabetes care, which we run very regularly. And this certificate course is taken by doctors, nurses, dentists, paramedics, dietitians, and they go back and try to educate their patients for promotion of health and prevention of diabetes, as well as maintenance of diabetes and rehabilitation of diabetes patients. This zone is this region is a region where the patients are coming who are poor with financial background, and they face challenges in buying the drugs for them. And the ignorance and illiteracy regarding care of diabetes is very high as per our statistics. Therefore, we urge that IDF create this as a center of excellence so that we can get an impetus in diabetes education which we are doing, or diabetes care we are doing, or diabetes research we are doing in this region, and this will fulfill the goals of IDF. India being a capital of diabetes, and this region, which is an underserved and deprived area, if gets a center of excellence, is going to be a huge, huge benefit for people of this region. Thank you very much.